Hey, it's Lizzie Carroll here from Lizzie Carroll Doula Services, your VBAC mentor and birthy bullshit sorter-outerer. For those of you who don't know me, I have been running the VBAC Australia group for the last 10 years. I have trained as a doula, a childbirth educator, and I have 3 children of my own. I had 2 caesareans and 1 free birth. And I will do a separate introductory post, which will include all of the information about my story and my journey, if you are interested in that. For today, I want to talk about risk. And I know that sounds very broad, and it is. Something that I am seeing a huge amount of at the moment for women planning a VBAC. And even women who aren't planning a VBAC are starting to get all bogged down in this. I have notes, just if I look down, I'm looking at my notes. Very unusual for me, but I want to make sure I cover everything. So I'm seeing a lot of women talking about choosing induction or caesarean as a way of, because they're not comfortable with risk. We also see a lot of commentary about, from people like the AMA, RANZCOG, private obstetricians, passing the blame for our rising caesarean rates onto women because women are more risk averse. So I wanted to have some of this information will be quite confronting. I want to have a really frank and open conversation about risk when it comes to particularly induction and caesarean, because these are insanely common. But when we talk about risk of interventions, every single intervention has risk. Every single non-intervention has risk. There is no risk-free way out of pregnancy. And if you are looking at an option or considering a test or a procedure and someone tells you there is no risk, they are lying. Everything has a risk. Home birth has risks, hospital birth has risks. Having an induction has risks, not having an induction has risks. However, something that I see a lot of is women not understanding that if you are well and healthy, every intervention introduces risk. So the outcomes from this are going to be that you will have an understanding of risk in the obstetric model. You'll be able to perform your own risk assessments when you are given information and recommendations and options. And I really want women to stop feeling like they are terrible mums and constantly putting their baby at risk. You aren't. Choosing a VBAC is not putting your baby at risk. Choosing an induction is not you choosing to put your baby at risk. I want you to be able to make risk assessments that are going to help you make powerful decisions so that you stop feeling like crap. If you have any questions, so this is obviously a pre-recorded video and non-interactive. However, wherever you are viewing this video, if you have any questions, please pop them below. As I said, this topic is very broad. It is very big. I'm hoping that this will be a mini masterclass. So I'm not going to spend hours, clarifying and extrapolating on all these different ideas. So I am more than happy to answer questions. I'm happy to answer them in another live. I'm happy for you to email me if that is your preferred way of getting your information. That's not a problem. My email address is lizzie@lizziecarroll.com.au, and I will pop that in the description for this video. So let's jump straight in. If you are healthy and well, having an induction or a caesarean introduces risk. Now, even if you are not healthy and well, inductions and caesareans introduce risk. And we need to really get clear on that. Yes, there are absolutely plenty of reasons why an induction or a cesarean would be a better option than waiting for spontaneous labor. If you have serious preeclampsia, if baby might have medical issues that mean they need to be born by cesarean because a vaginal birth is just not going to work for them. You might have placenta previa, in which case baby can't even get out, even if you do wait, because the placenta is covering the cervix. So there are definitely reasons why a cesarean or an induction would be a better idea than waiting. That doesn't mean, just because an intervention is medically necessary, doesn't mean it ceases to have risks. It doesn't mean those risks all of a sudden disappear. And you'll notice that I'm not going through what all the risks are. There are so many, and if you want to learn more about what the actual risks are and you want to see that all laid out, let me know. I have plenty of information about that I can share. So inductions and cesareans introduce risk, even if they are necessary. Your body doesn't go, oh, this is a necessary cesarean, let's make sure she doesn't get an infection. Or, we have very severe preeclampsia, this induction is very necessary, let's spend the next 5 minutes putting all those finishing touches on baby so that baby doesn't have breathing issues due to being premature. It's not a thing. You still have those risks, even if it is necessary. And knowing those risks means that you can mitigate those risks. It means that you can actually perform a risk assessment. And it means that you can make a fully informed and powerful decision. Sitting there and going, this is necessary, I don't need to know the risks, I am just going to close my eyes and hope for the best, is not a powerful choice. It's a totally valid choice, I get it. If your cesarean is really necessary, you probably don't want to be hearing about, you know, how you're at increased risk of fertility issues down the track, or how this could impact on your next pregnancy, how this is going to increase your chances of placenta accreta in your next pregnancy. But knowing these risks means that you can make a powerful decision that is right for you. And it means that you can actually start to think about how you're going to mitigate some of those risks, and, you know, different techniques and tools for managing that. Managing risks is not just your obstetrician's job. It's not just your midwife's job. Managing risks is essentially, it's just you making decisions around what you do and do not want. And it is just as much your job as it is your clinician's job. They don't cease to have risks just because you have chosen them. Just because you have gone, you know what, an induction is best for me, I don't want to hear anything about any other options, it's the right choice for me. That doesn't mean you suddenly have no risks associated with that. Again, it's totally valid for you to choose an induction because, you know, you need to go to someone's wedding, or you've got other social concerns. It's not for me, but it is for many people. So a situation that they find themselves in. That doesn't mean that the risks disappear. They are still there. And again, knowing those risks means that you can mitigate them. It means that you can manage them. It means that you can ensure that you are making powerful decisions along the way. And those risks also, they don't disappear just because you are oblivious. Now, some women are oblivious by choice. They simply do not want to know what the risks are associated with the decisions that they are making. And I want to be really clear, no matter what, you are the one making these decisions. They are all your decisions, even if you are completely oblivious to the risks, and you can choose that. I feel like most of the women watching this video, if you are following me, you're probably not falling into that category. But we all know someone who does, right? We all know someone who has just gone, I don't care. My doctor can do what they want to do. I don't need to know any risks or anything because my doctor would never do something risky. And that is something we are going to talk about further down in this video. But yeah, just because you're oblivious to the risks doesn't mean they don't exist. And a lot of women find themselves in the position of being completely blindsided because they didn't know something was a possible outcome. I know women who have completely unnecessary inductions that result in forceps deliveries or result in vacuum deliveries or result in cesareans, and they go, oh, I didn't know that was a possible risk. Women who have artificial rupture of membranes and end up with a cord prolapse. I didn't know that was a risk. Women who, have syntocinon and then have a postpartum hemorrhage. Didn't know that was a risk. So just because you don't know the risks doesn't mean they don't exist. And in a perfect world, in a perfect maternity care setting, our care providers would be making sure we know what these risks are and making sure we know our options, our alternatives, making sure we know the different ways that we can manage these risks, making sure we know that there are alternative options that have different risks, because our alternative options don't have no risks, they have different risks. But often that's just not the case. So yeah, induction and cesarean introduces risk, always. Sometimes that risk is absolutely necessary. It is necessary to bear that risk because the risks of not doing that are risks that are not acceptable to us. And sometimes, if you are perfectly healthy and your baby is perfectly healthy, I often say to women, why would you want to introduce additional risks if you and your baby are well? And I will do a whole different masterclass on gestational diabetes, but the vast majority of women with gestational diabetes or who have been diagnosed with gestational diabetes are perfectly well and their baby is perfectly well. And an induction does just introduce risk. So the next point is who bears the risk. We need to have an understanding of this in order to be able to help inform our decisions. I've had a bit of a cold, so I'm having some coffee to try and keep my throat working. So the physical risk obviously is borne by mum and bub. Obstetricians don't die as a result of cesareans. Your obstetrician isn't going to be raced through the corridor with someone's hand holding their baby up so that up in the cervix so that the cord doesn't come down. Your obstetrician is not going to be, doesn't bear the risk of potentially still dealing with infection 10 months down the track. They don't go home to your toddler, your newborn, and attempt to parent, attempt to mother, attempt to breastfeed while recovering from major surgery. Those just aren't risks that obstetricians bear. Those are risks that you bear. Which means it's very personal around how you assess those different risks and what sort of impact they would have on your life. The risk of cesarean for me was just too great for me to plan that. I already had 2 children. Knowing that going to hospital meant that I had like a 40% chance of having a cesarean, that was too great for me. For other women, it's not. So for me and my partner, it was very easy for us to say, our priorities are ensuring that I am well and healthy and able to mother our older 2 children, that I'm not dealing with trauma, that I'm not dealing with recovering from surgery, and therefore a free birth is the best option for us. That is not going to be the case for everybody. And I know lots of people think that I am very much here to just tell you have a free birth. No. Free birthers are, you know, a very, very small part of the population. They're a very small part of my client base. Most women who I talk to, most women who I help are birthing within the hospital system, just to clear that up. But when we talk about risks and mum and bub bearing the risk, you also bear the emotional risk, the mental health risk. You know, there are lots of risks. There are social risks. You know, for some women, for me personally, if it was a member of my family getting married and they want me to have had the baby so that I can go, I'd be like, nah, bullshit. I don't care. I'd rather just not go. I'd rather not go to your wedding. I'd rather not have to deal with people. But other people and other family dynamics, that is a huge thing. So it is really important to assess the types of risk that you are, you know, exposed to, and what those, you know, how those risks fit into your life. Your obstetrician, on the other hand, bears some legal risks. Now, when we talk about choosing cesareans and inductions because we are risk averse, it's not us. No woman who is risk averse, no healthy woman carrying a healthy baby, having a healthy pregnancy, who is risk averse, is going to be choosing to introduce the risks that come with induction, particularly early term induction, so from 37 to 40 weeks. And they are not going to be jumping into the, in fact, women who are healthy and risk averse are generally going to be having a midwife assist them with their birthing their baby at home. They're going to be choosing birth center births. They're going to be choosing births that are actually going to introduce birth settings and birth care providers who are going to introduce less risk. They're probably not going to be in this position. But yeah, women who are risk averse are not going to be choosing unnecessary cesareans. They are not going to be choosing early term induction if they are well and healthy and it's not needed, because it introduces a whole lot of risk, which leads me to believe that a lot of women are not being informed of the risks associated with inductions and cesareans. And the risks associated with inductions, we focus so much, especially in the VBAC world, on that risk of it'll result in another cesarean. And that is a risk. But induction has so many other risks that women just do not focus on. I see the question all the time. Did you have an induction? Did it result in a cesarean? No one's saying, did you have an induction and did it result in a cord prolapse? Did you have an induction and did it result in your baby experiencing fetal distress? Did you have an induction and did it result in baby being malpositioned? Did it result in iatrogenic prematurity, which is where baby is induced and comes out and needs extra special care help because their lungs aren't developed and they are essentially premature? So those are definitely things to consider. But for obstetricians, what I often hear is the saying, you don't get sued for the cesarean you did perform, you get sued for the cesarean that you didn't. So they are mitigating their risks. Now, if something goes wrong during your birth and the obstetrician needs to, you know, is being examined, being looked at, being investigated, that's what I was looking for, being investigated, they don't go and ask other women whether they consider that what the obstetrician did, said, recommended seems reasonable. They go and ask other obstetricians. So when we look at legal risk here, obstetricians need to be behaving in a way that other obstetricians see as reasonable. It is very, very, very uncommon for an obstetrician to find themselves in trouble or seeing any consequences for performing unnecessary cesareans. For performing cesareans on women where they told them that their baby was going to be 13 pounds, but baby was 7 pounds. Performing cesareans on women where they told them that they just could not give birth vaginally, but those women go on in their next birth to give birth vaginally. You know, we don't see obstetricians being sued for recommending an induction at 38 weeks and baby then needing special care for a couple of weeks because they're not ready. What we do see is obstetricians getting hauled over the coals for not performing inductions and cesareans. So I think that this is something that women need to be very, very aware of. If something goes wrong in your birth, they are not going to ask other women. They're not going to ask midwives, you know, whether they feel that this was reasonable action. They're going to ask other obstetricians and they're going to ask hospital administrators. And I think that is really, really telling when we look at risk assessments and when we look at how obstetricians present information regarding risks. So that's it. I think I went a little longer than I wanted to, but that's okay. If you have questions, I would love to hear them. I would love to see women start writing out some risk assessments. That is a very practical thing that I would like you to take from this, is to start performing your own risk assessments and ensuring that they are based on all the risks. Where are you getting your information about the risks of your birthing choices? And keep in mind that your birthing choices involve a lot more than whether you're going to have a cesarean or an induction, and whether you're going to plan for a spontaneous vaginal birth. But where are you getting information on the risks, the benefits, the alternatives? How are you fitting that into your own personal risk assessment? Are you looking at things like emotional risks, social risks, mental health risks, risks relating to previous trauma? These are all really valid things that need to be considered in your risk assessment. And how does your risk assessment stack up with your care provider's risk assessment? When they give you information and they start talking about things being risky, ask them, what are the actual risks? What are the alternatives? What are your suggestions to help manage this risk? Where can I get further information about this? And that's a big one. Obstetricians need to be able to tell you where you can get further information. If you're only getting information from your obstetrician, you're not making a fully informed decision. I will die on that hill. That is simply, you cannot make a fully informed decision if you are only getting information from one source. So that's it. If you have questions, I would love to hear them. If you have feedback, if you have thoughts and feelings about this, please let me know. If you have ideas for other topics that you would like me to explore, that you would like me to share information on, please let me know. I would love to hear that. I hope that you all have a beautiful day. I cannot wait to see the power that you create in your VBAC journey, and I'll see you all again soon. Bye.